Welcome, and thank you for joining today's conference, Translating ROS Services to Reports. Before we begin, please ensure you have opened the WebEx chat panel and Q&A panel by using the associate icon on the bottom right corner of your screen. Please note that all audio connections are muted at this time. You may submit written questions throughout the presentation, and these will be addressed during the Q&A. To submit a written question, open and select the Q&A panel at the bottom right of your screen using the three dots next to the chat icon. Type your question, select all panelists, and send. You may use the chat for other comments, engagement, or technical assistance. If you require technical assistance, please send a chat to the event producer. And as a reminder, this conference is being recorded. And with that, I'll turn the conference over to Stephanie Adams, ROS Program Manager. Please go ahead.
Good afternoon, everyone. Thank you so much for joining us. We're thrilled to have you on today's call. So as you know, today's webinar is the second in a three-part series of reporting webinars aimed to really help you navigate ROS reports, navigate what we're looking for in those reports. And today's webinar specifically focuses on real-world examples of service coordination and the data elements that you can use to reflect those services that we may provide. And thank you, Michelle. Next slide, please. So as Michelle mentioned, my name is Stephanie Adams. I am one of the program managers for the ROS team, and we are fortunate to have Louis Dorman with us. Louis, if you don't mind introducing yourself.
Thank you, Stephanie. Hi, I'm Louis Dorman, and I'm also one of the ROS program managers. It's a pleasure to be here today and to work with all of you.
Thank you so much, Louis, and we're happy to have you. So thanks for being with us. We also want to recognize Dina Lehman Kim. She is a ROS project lead for us. Trey Humans is the deputy director for the Community and Supportive Services team. And we are fortunate enough to have Joseph Taylor on the call with us as well. Joseph, if you don't mind stepping off and mute and introducing yourself as well.
Thank you, Stephanie. Hello and good afternoon, everybody. This is Joseph Taylor. I am the Grants Management Specialist here at HUD ONAP headquarters in Washington, D.C., representing the Grants Management Division. Thank you all for attending this webinar. You're in for a treat. Glad to be here. And so we're in good hands with Stephanie. Thank you.
Wonderful. Thank you so much, Joseph. And I'll also speak for our Office of Field Operations. We have Charles Eldridge, the National Grant Manager, as well as Janelle Jones, who is also National Grant Manager. Wonderful support to the Office of Field Operations side. And also we want to acknowledge all of the many local HUD Field Office representatives from ONAP on the tribal TDHE side, as well as OFO for the public housing side. All of us together make up the ROS team, and next slide, please. Great. So before I jump into reporting, I see a few folks have bravely taken the initiative of introducing themselves in the chat, and I encourage all of you to drop your name, drop where you're writing from, what grantee you represent, get to know each other, get to know who of your peers are here with you on this call. I see we've got a few folks from Springfield, Illinois. That's great. Rossburg, Maryland. It's wonderful. We welcome you all. So keep them coming. We'd love to hear who's with us. Okay, Red Wing, Minnesota. Great. Florida, Philadelphia, Ohio. Wonderful. Okay, so if you were on the last reporting webinar, you might remember this slide. This is just a reminder slide of the importance of reporting. It serves many purposes, right? So it's a great tool that you can use to assess your own program, look at where is it working, where are there gaps, are you reaching your target audiences? All of this you can use by checking your data and seeing what the numbers can tell you. It's a great way to build and sustain partnerships, especially those match partnerships. As you all know, a statutory requirement is to have 25% match commitments. So, one way to solicit and sustain those commitments is to be able to track the impact that your match partners have and to be able to show them, because of the maybe digital literacy classes that you provided, X many of residents were able to gain some of these skills, and so many residents had these outcomes from the class that you provided. So it's just a great way to sustain those partnerships, show the value of the relationships that you've built. The reports that you submit, that's directly exported into the ROS dashboard on HUD Exchange. And the dashboard has a lot of really cool tools that you can use to track services over time, look at outcomes. And so if you're not submitting reports, or if there's poor data quality, then you'll just have less that you can use in that dashboard. So definitely take advantage of reports, take advantage of the dashboard and all the analysis tools that allows. It also helps us help you, essentially, right? Because we can look at your reports, we can understand what your program implementation looks like, and we can tailor technical assistance to meet you where you're at, and maybe support you in areas that you want to improve. Reporting is a requirement in your grant agreement. So reporting is something that's necessary in this grant, and it'll keep you in compliance. And lastly, we submit congressional justifications for the ROS program. So you're helping us to justify the many great services and outcomes, the diverse, people that are being touched by this program. You're just helping us to, demonstrate that and justify continued funding for this program. Next slide, please. And Michelle, I think we're ready for the next slide.
Stephanie, I just
Okay,
switched the
great.
slides. Do you see it now?
I do, yes, thank you,
Okay, great.
thank you. I think there might have been a lag, but perfect. Thank you so
Yeah.
much.
Mhm.
Great. So in our last presentation, we shared with you that having case management software is a best practice for our grantees. And in our last reporting webinar, we asked all of you to put in the chat and share with us what are some of those benefits that you see. So in your own words, what do you stand to gain from having case management software? So these quotes that you see on the screen are just directly from your peers who have case management software, attestations to the benefits that it might provide. Talking about the ease of reporting, technical support that you might have in submitting those reports, streamlining your efforts, helping you to identify missing information, having follow-up reminders. And in this table, you can see, I believe it was 91% of those on our last call said that case management software is helpful for ROS report. It's an overwhelming support that case management software, is the best practice for our grantees. So if you do not have case management software, we encourage you to consider that as another tool that can help you implement the ROS program and keep up with the requirements of reporting. And next slide, please. Great. So as a refresher, what data are we looking for in your performance reports? The performance reports, again, are those that are in grant solutions using standards for success. We want to see these three pieces: demographics, services, and outcomes. Next slide, please. And as a refresher, so these are the areas of need. that we've outlined in your NOFOs. And what we're going to do today is I'm going to look at, we'll narrow in on each of the areas of need, give you a real life example of service coordination that you might do within that area of need. And then we can talk about, what's a helpful service code that you could use to reflect that service provided? What are other standards for success data elements that you might use to reflect the outcomes from that service? And how does it tie into the NOFO, those key performance indicators that are tied to each area of need? And next slide, please. Great. So first is digital inclusion. And Michelle, if you can share that service example. Perfect. So in this first scenario, resident walks in your door, work with the resident, and connect that individual with the digital literacy classes. So Michelle, if you can pull our very first poll for the group, and I'll explain that what we're going to ask you to do is I'll show you some options for what you could code this service as, and I'll ask that you please select which option you think that you would use to reflect this service. The service, again, is connect a resident with digital literacy classes. And we're giving 60 seconds. If you can submit your response. The options are service coordination service code, mental health service code, career guidance service code, or independent living service code. Looks like we have about 30 seconds left, so would love if you're able to go ahead and submit a good response. Oh, great. Thank you, Michelle. It looks like you can access the poll by opening the field below the chat. And time. Michelle, can you share with us the results?
Your results should be up.
Great. Okay, great. So I see 41 folks said service coordination, no one said mental health, 24 said career guidance, and 17 said independent living. So Michelle, if you can share the data elements. Great. So in reviewing the data guide and your options, the ROS team would say that the service coordination service code most closely aligns with this service. Forgive me, my cat Deirdre wants to say hello to everybody. So in your data guide, we say that the service coordination service code, this is a little more information that we provide about that. So that includes establishing linkages with appropriate agencies and service providers in the general community in order to tailor the needed services to the individual, linking the individual to providers of services that the individual or family needs, and educating individuals on issues including but not limited to supportive service availability, application procedures, and client rights. May include but not limited to organizing a health fair, job fair, or providing case management to a resident. So it's a mouthful, but I would say generally that if you don't see a service code that is narrowly specific to the service that you've provided under the parameters of the ROS grant, then service coordination is probably kind of your catch-all case management service that's helping move the needle on self-sufficiency. So digital literacy, we don't have an exact service code for that. Looking at the other options, that's the moment when you might go to the service coordination service code to capture that work that you've done. And then next you see enrollment and educational programs. So this could be how you reflect the outcome. So digital literacy, that's educational, right? They're gaining skills in digital literacy. So they've, if they're attending this class, that means they've enrolled in that program. And you can, give your program credit for that success in enrolling that resident in an educational program. And Michelle, if you can share the key performance indicator. Great. So again, in your NOFA, we outline each of the areas of need. We also give you key performance indicators. And you can see that one of those key performance indicators for digital inclusion is residents without digital literacy skills enroll in digital literacy classes. So there's direct alignment between what we see as a success under this area of need and the data elements you can use to code the work that you're doing under that area of need. Great, and next slide, please. Okay, education. So the service scenario here is connecting a resident with study tools to take the GED. And Michelle, if you can please pull up the second poll.
Okay, and before I do that, just everyone, you can get the poll results. It should open up below your chat window, and if not, there's 3 dots next to the chat icon located on the menu, and you can open the poll there. So I'm going to go ahead and open poll number 2.
Great, thank you, Michelle. Thanks for that guidance. Okay, so we have 60 seconds. The question is, what data element would you use to reflect this service in your ROS report? Your options are A, Career Guidance Service Code, B, ESL Class Service Code, C, High School/GED Preparation Service Code, or D, Service Coordination Service Code. And again, the service is you're connecting a resident with study tools to take the GED. Got about 15 seconds left. And that's time. Thank you all for participating. Michelle, can you please share with us the results? Okay, great. So I see 4 for career guidance, 1 for ESL, and a whopping 94 for high school/GED preparation, and 7 for service coordination. Okay, great. And Michelle, can you please share with us the data elements? Great. So in this case, there is a service code that is specific to, exactly what you've done in this scenario. So there is something that specifically calls out providing that GED prep. So because there's a more specific data element that's available to you, we would encourage you to use that one to really tell us exactly what work is being done. And remember, in the previous example, service coordination was the best fit, and that's just because there wasn't a more specific service code available. So service coordination served as the catch-all. But here, because you can narrow in and tell us exactly what kind of case management it was, we'd rather hear that. And then I've also included the degree attainment code because that's where you can reflect those outcomes, right? So you can tell us that, hey, you provided study tools for the GED, and, so many months later, the resident took their GED, they passed, and now they have attained that degree, and you can reflect that in those outcomes. And you can just track, how you're moving the needle in the area of need on education. And I'll just share with you from the data guide what we say. In the data guide, we provide a description, comments, and some more categories of information for each data element. And so for this one in particular, the high school/GED preparation service code, we say this may take the form of classes, online course, or one-on-one tutoring. So think of it as, just kind of the broad gamut of what do that GED prep resources look like, and this is your applicable code. Michelle, if you can share with us the key performance indicator. Perfect. So again, tying back to the NOFO, where we tell you the key performance indicators under education area of need, we say one of the KPIs could be a resident without a high school diploma or GED attains one. So in this case, it's directly aligning with what we'd love to see happen under that area of need. And next slide, please. Great. So elderly and residents with disabilities, service scenario. You help a resident complete and submit an application for SSI, Supplemental Security Income. Michelle, if you can please share with us the new poll. All right, 60 seconds. So the question is, what data element would you use to reflect this service in your ROS report? Your options are A, Housing Placement Service Code, B, Conflict Resolution Service Code, C, Household Skills/Life Skills Service Code, or D, Service Coordination Service Code. We've got just about 20 more seconds for those of you who are navigating now to submit your answer. Would love to hear what you think. Great, and that is time. Okay, so our results here, we had 4 votes for housing placement, 1 for conflict resolution, 17 for household skills/life skills, and 83 for service coordination. Michelle, can you please share with us the data elements? So here again, we saw service coordination best aligned with this scenario. The reason being that the other service codes might be a little more specific to, they might be narrowing in on just different sets of skills, different kinds of work. And here, the service coordination service code really captures those, applications that might not be called out by name, that one-on-one case management to help submit and complete an application for SSI for different resources that again aren't called out by name in the data elements. There is specifically a supplemental security income code that's part of the standards for success data elements. So that's where you can show us outcomes, right? You can say, as the service coordinator, I met with this resident, I helped them complete the application, fast forward 6 months, hopefully not 6 months, however many months, and great, they have SSI. I can reflect this in my report and we can see that the work being done at my properties is having an impact. And Michelle, if you can please share with us the key performance indicator. So in this area of need, elderly and residents with disabilities, a KPI that we indicated in the NOFO is that a resident receiving supplemental security income and Social Security disability insurance. So perfect. It's, that's exactly what we are looking to see in the intent in our NOFO for this grant. Great. And next slide, please. Employment. All right. So the service is, as a service coordinator, you work with a resident one-on-one, you coach them to refine short and long-term career goals. Michelle, if you can please share with us the poll. All right, 60 seconds. So the question is, what data element do you use to reflect this service, which is coaching a resident to refine short and long-term career goals? Your options are A, Career Guidance Service Code, B, Parenting Skills Service Code, C, Job Retention Service Code, D, Adult Basic Education Service Code. 30 seconds left. Just a few seconds left for those hoping to submit a last answer. Great, that's time. And Michelle, if you can share with us the results. Okay. So we have 93 folks say career guidance. No one said parenting skills. 11 said job retention, and 1 said adult basic education. Michelle, if you can share with us the data elements. Great, so here we're looking at career guidance. This is just it has the most direct alignment between the two. So for example, you could say that, I understand you could argue that by coaching someone where they want to go in their career, that maybe you're helping to, build a long-term, helping motivate them to stay in their career, and that could reflect on job retention. But if you have to compare the two and look at, and ask yourself, which one is just the most direct relationship between the two, we see that closer connection with career guidance. And the data guide says of career guidance that these services include the provision of information, materials, suggestions, or advice which are intended to assist the job seeker in making occupation or career decisions. This can be done by the ROS service coordinator or by a service provider. And then you can see in the data elements, you can see this reflected in employment status code. So for example, maybe this is someone who's unemployed and you're providing this coaching, and through that coaching, you see changes reflected in their job status, and they're able to secure a full-time position within 3 months. That's one way that you could see the outcomes, see the impact reflected. These scenarios are like limited in scope just to try and kind of work through cases as a group. But of course, I know there's a lot of standards for success data elements, so there could be a lot of ripple effects, right? And we want to see all of that data shared with us so that we can see the holistic gamut of impacts and outcomes that might come out of this service. But it's just an exercise to try and kind of cue you to some direct correlations to these real world life examples. And Michelle, if you can share with us the key performance indicator. Great. So in your NOFA, we say a KPI for employment could be residents receiving employment-related services. That would definitely be career coaching, right? And next slide, please. All right, financial literacy. I know a lot of you have this as an area of need. So the scenario is you help a resident establish a bank account. All right, Michelle, if you can share with us the poll. 60 seconds, all right. So again, the question is, what data element do you use to reflect this service of helping a resident establish a bank account? Is it A, Adult Personal Assistance Service Code, B, Financial Account Creation Service Code, C, Mental Health Service Code, D, Service Coordination Service Code? All right, we'd love to hear what you think. Got about 30 seconds left. Ten seconds. And time. All right. Okay, so no one says adult personal assistance service. No one says mental health. 5 said service coordination, and a whopping 102 said final account creation. Michelle, if you can share with us the data elements. Great, great. So you guys are doing awesome. Yep, so in this case, financial account creation service code is one of the standards for success data elements. It directly aligns with the service that was provided. So for that reason, it's, you have a specific option available to you. So we'd encourage you to select that one rather than the service coordination service code, because that service coordination service code is a catch-all when there's nothing that's, specific to it. So in this case, financial account creation service code. And then there's also the financial account creation code, which is, where we can see the outcomes. So the service is that, you're helping the resident through this process, and the outcome, the result is, hey, now they have, a checking account in their name. And Michelle, if you can please share with us the key performance indicator. So in the NOFA, we say residents with no financial account receiving a financial account. Great. So that's exactly aligns with, this scenario and the data elements that support it. All right, next slide, please. You guys are doing great. We're working our way through these areas of need, and hopefully this is a helpful exercise. All right, so health and wellness. The service is that you're helping a resident schedule a medical appointment to establish primary care. Michelle, if you can please share with us the poll. All right. What data element would you use to reflect this service in your ROS report? Helping a resident schedule a medical appointment to establish primary care. All right, your options are A, Occupational Skills Training Service Code, B, Legal Assistance Service Code, C, Medical Service Code, and I think it's Medical Care Service Code, or D, Adult Personal Assistance Service Code. Let us know what you think. All right, last 5 seconds. And that's time. Okay, wow. So we've got no one said occupational, no one for occupational service code, no one for legal assistance service code, 2 people said adult personal assistance service code, and 101 said medical service code. Michelle, if you can share with us the data elements. All right. Yep. Medical care service code. Yeah, you guys are doing great. And you can see again here, the outcome really aligns with the service that's being provided. So you can track, do they have a primary healthcare provider? And, as a result of this service, say the resident does in fact connect with that primary care physician with whom you scheduled that appointment. Great. So now you can indicate in your reports, yes, this person does have primary health care provider established for them. And, we can track the impact that you've made in your work. Michelle, if you can share the key performance indicator. So in the NOFA, we say residents receiving health-related services. That's a pretty good catch-all, right? But definitely this fits within that, establishing primary care. All right, next slide, please. Re-entry. Here's the scenario. You're helping a resident who is a returning citizen expunge their record. And Michelle, if you can please share the poll. Great, 60 seconds. All right, what data element would you use to reflect this service in your ROS report? And again, the service is helping a resident who is a returning citizen expunge their record. Your options are A, Legal Assistance Service Code, B, Mental Health Service Code, C, Housing Retention Service Code, D, Service Coordination Service Code. I think this is a tougher one. I'll be curious to hear what everyone thinks. 35 seconds left. All right, getting those final answers. We've got just a few seconds left. And time. Okay, 99 said legal assistance, 1 said mental health, 3 said housing retention, and 7 said service coordination. And Michelle, if you can share with us the data elements. So in this case, again, there's that direct alignment, right? So it's expunging a criminal record. Taking those steps would be, working with someone, providing legal assistance. So because there's a service code that, directly calls out what that is, there's just that direct relationship. Legal assistance is the one that we would advise. And here again, you can, surmise that there could be positive effects on their mental health. Maybe they're relieved. It's a huge stress reliever. It's removing a major source of anxiety. Maybe it's, helping with their housing retention. But those are, if you look at these different options, I would just encourage you to think, what has the most direct relationship? If I had to really boil it down to at its core, what is it doing? That should help you identify, what is really at the heart of this. So in this case, we would say legal assistance. And we do have a code for returning citizens and ex-offenders. So that's where we could see that, help us understand that, okay, if you selected reentry as your area of need, we see that you're working with participants who are returning citizens and you're providing them legal assistance. So it makes sense to us that, you're performing work that falls under this area of need. So that just helps us. These are data elements that help us to understand your work and how it ties everything in. And if we can please see the key performance indicator. So the NOFO, it says residents involved in the justice system receiving legal aid as services. So that's great. This service certainly falls within that. All right, and then we're on our last one. Michelle, if you can share, substance abuse. In this scenario, you, as a service coordinator, you refer a resident to a substance abuse rehabilitation center. And if we can please see the poll. Great, last one. Thank you all for your participation. So, question is, what data elements would you use to reflect this service in your ROS report? And again, the service is a referral to a substance abuse rehabilitation center. Is it A, medical care service code, B, mental health service code, C, adult personal assistance service code, or D, substance abuse service code? And again, think about what has the most direct relationship. Even if you could categorize it in more than one, which one feels the most direct? About 20 seconds left. All right, that's time. Thank you all for your participation. And let's take a look at the results. So we have 2 for medical care, 3 for mental health, 3 for adult personal assistance, and 101 for substance abuse. And Michelle, if you can please share the data elements. All right, so we're looking for substance abuse. So again, that just has the most direct alignment that helps us understand that it falls directly within this area of need. And if you look in the data guide, the data guide, again, provides descriptions and comments for every data element. And for substance abuse service code, it says this may include prevention and intervention services. So if you know that you helped, you help provide the substance abuse intervention service, it really directly aligns with that substance abuse service code. And if we can please see the key performance indicator. Great. So residents with drug or alcohol dependency are receiving voluntary substance use treatment. Direct alignment, right, between treatment and connecting with that rehabilitation center. We can see how, the intent follows the data elements that we're asking you to record. All right, and next slide, please. Great. So again, thank you so much for participating in that exercise. I hope that it's helpful in some way just to kind of share with you where we're thinking, how we're interpreting the data elements from the HUD side as you work through this and navigate those standards for success data elements in your work. So closing, before we take questions, we are closing with just a few important reminders. So here you can see the reporting period and due dates. Some of you may have FY18 reports that are still current. And bear in mind that those report due dates are 90 days from your grant term end date. For many of you that may have passed already, but if you had an extension that may be longer. If you are FY19, FY20, and FY21, you're all looking at October 30th as your next report deadline. For FY19 and FY20, that'll reflect a full reporting period, full year of your reporting period, because you're more in the middle of your grant. And for FY21, that year one report will look like, it will reflect data collected from June 1st through September 30th. So we understand that'll be a shorter data collection period, but we want to see what work is being done during those initial months of your grant. Next slide, please. All right, so some reminders on data quality and availability. As I've mentioned, the data guide is a great resource. We have descriptions and comments for all the different data elements that you can look at. If you're not sure exactly which one to code, feel free to review that and see, based on the information there, get more insight into our intentions behind each of these codes and how we might encourage you to code based on the service that's being provided. Some of the standards for success data elements, your responses might be information not collected or not applicable. We also have comments that can help you navigate that and help you determine what you should code if you don't necessarily have a direct answer for some of those data elements. So again, refer to that data guide. It should be a really helpful resource to you and will provide some guidance in that way. This is a really, reporting and data quality are really key pieces of your performance. We're really looking to strengthen the reporting and the data that we have on the ROS program. And the more information that we have, the more complete our data is, the better it can help all of those reasons that were listed on the importance of reporting page. It can help all of those efforts. So we certainly encourage you to do everything you can to, collect thorough data. And I think we're ready for the next slide, please. Great. So we have a lot of really wonderful resources for reporting. Hopefully you're familiar with the ROS HUD Exchange page. That's where we have archived past reporting webinars. We encourage you to take a look at those. The data guide, which I've been data guide were a person, I think its ears would be burning, right? Because I've been talking it up this whole webinar. And it's a really great resource. I definitely encourage you to keep that handy, especially if you have questions as you're going through the report. I think a lot of answers are in that document. We also have the data dashboard where you can see and work with your data, see it in charts, analyze it, really, delve into some of the nuances of your data. Soon, very soon, hopefully the end of this month, we will be opening up some one-on-one technical assistance with reporting sessions. So please stay tuned. And as I mentioned, this is the second in a 3-part reporting webinar series. So we do have the third reporting webinar, which is scheduled next month. Please stay tuned for that invitation and more information on that. That will include a walkthrough with Grant Solutions and our GMO team to really show what it looks like to go through, navigate the online data collection tab in Grant Solutions and see how you can input reports. It'll be really helpful information sessions. We certainly hope you can join us. And we'd like to say also that, of course, we encourage you to review all of these resources first. But if you've taken a look at these and if you feel stuck, if something doesn't quite make sense, we're available to you as resources. So you're welcome to reach out to, especially to the ross-pih@hud.gov inbox. And if you want some more support or you have some more questions, you're welcome to reach out to us there, and we can help guide you through some more tailored technical assistance through this. As well as your local HUD field office representative, it'll be helpful to include those individuals on any issues or further support that you're seeking. And next slide, please. Great. So Michelle, if you can please end the recording here.